Hi, everyone. I'm Kathryn Alfonso, and I'm actually relatively new. I just started here about 6 weeks ago, but I'm over at the Orthopedic and Sports Medicine Institute. And I'm here to talk to you about something that is near and dear to my heart, or maybe you could say to my butt, but hip pain. It's something that I see very commonly in my practice. And it's something that really affects a lot of people on a daily basis, and particularly women. So I will start by going through a little bit of anatomy, which I know that bores everybody, and I'm sorry, it's a little bit nerdy, but I was trying to figure out how best to talk about the hips and pelvis without talking a little bit about anatomy. So bear with me for just a couple seconds. We're just going to go over some of the basic anatomic structures that make up the hip joint, first of all. So this is actually the hip joint when we refer to it. And I know when we talk about hip pain, we might talk about something on top. Sorry, I don't have a pointer, I don't think.
There is one. There's two.
If I can figure out how to use it.
You can use the mouse on the thing, or there's two of them up there.
Here we go. All right, mouse. Can you see my mouse? Perfect. So a lot of hip pain people might think is here. It might be in here. Sometimes we think about hip pain here, and very rarely do we think about hip pain in the groin or out actually on the side of your hip. But a lot of the pain is actually out on the side of your hip. But the actual hip joint itself is part of the pelvic bone, as well as then the femur. So this area right here in the red circle is actually the hip joint. So then I really can't talk about the hip without talking about the butt muscles, so the glute muscles, especially with the title of my presentation. So we are going to talk about the glute muscles, and there are specifically 3 of them. The first one is the glute max. That's the one that actually makes up the butt and what people think of as the butt muscle. However, I would argue is maybe not the most important one, although it is the biggest. And that actually extends our hip. So it's big, it is a big player in walking. However, it doesn't cause most of the pain that we see in hip pain. So this guy is the glute max. Glute medius, I'm a little bit biased, but I'm going to say it is the most important muscle in the lower extremity. And that one is not actually very much involved. It does help with walking, but it actually helps with a lot of side to side movement, which is not something that we get in our daily activities anymore, unless we're playing basketball or specifically working those muscles. So that one is a big player in hip pain. We do have some other ones. We have the glute minimus, which is also a little bit of a player in that. And then we have the piriformis, which is a whole other talk of hip pain, which I'm actually going to not talk too much about that guy, but it can be implemented in a lot of hip pain. So I don't know how many of you have had hip pain in the past, you're currently experiencing it now, and have been told, it's arthritis, and I'm really sorry, but you just have to live with it. Maybe there's some things you can take anti-inflammatories such as ibuprofen, but really you're stuck with it. It's wrong. Not everything is arthritis. Actually, there's a lot of it that is not arthritis. And I'm going to start by talking about a syndrome, which I don't know if you guys have been in over the orthopedic center or in musculoskeletal medicine, but everything is a syndrome because a lot of times there's multiple things that are going on and it's really difficult to explain. So I'm going to talk about greater trochanteric pain syndrome. So that bone that I pointed to on your femur, this guy right here, that is where a lot of the pain is. So if you take your hands and you put them on your hips, those are the big things called the iliac crest here. So when we're resting our hands on our hips and being all sassy, those are the iliac crest. So if you then take your hands and slide them 6-10 inches down onto your leg on the side, that right there, that's part of your femur, but that is actually where a lot of hip pain occurs. And that is because you have all of those muscles, my favorite, the glute medius over here, and then also your glute minimus, this little guy here, those attach there and they have to make a really big curve to get around there. And so they end up being a really primary generator of pain. So just a few facts about it. I promise I'm not going to bore you with a whole bunch of stats. However, this is very common in physically active and sedentary persons. It is unfortunately more common in women than men, which is why we're talking about it today. 15% of women, 8% of men complain about this and suffer with this. And 1.8 per every 1,000 patients seen in the primary care setting have this problem. So where is it exactly? So as I talked about, you stick your hands on your hips and then you move your hands 6-10 inches below that. Right here where this girl is pointing, this is where all those muscles attach. And that is where you might find a lot of your pain. And unfortunately, in musculoskeletal, you have pain, but then you also have like this radiating pain, which makes diagnosis sometimes pretty difficult. And I know it can be very frustrating for patients. They come in and tell me, oh, well, sometimes it's here, but sometimes it's here and my knee hurts. And then sometimes my ankle even hurts. And I don't understand why, because it all started with my back. So, so a lot of pain, especially in this syndrome that we have here. It can hurt when you're running or walking. It might wake you up at night. You might be laying on that side and you're like, well, can't sleep, got to roll over to the other side because my hips hurt so bad. You might have it with squatting or bending at the waist. You might literally just have a pain in the butt. And then you might have it down on the outside of your thigh. It's very annoying. And in fact, I experienced it for the first time in the last few months. Really wasn't happy about it. So what is it exactly? So I already talked about it. It's pain on the outside of your hip. Cool. All right. So there's a whole bunch of things that it could be, but we're going to try to narrow it down to just a couple of things because it makes it a little bit easier to understand. So there's a term called bursitis. Maybe you've heard of it. What it is that's actually a potential space, and it's a space there to be helpful. It helps tendons glide over each other. It tries to reduce friction. It might be trying to reduce friction between a tendon and a bone or a tendon and a tendon. And that's all really great until it's not. And until you've had so much friction that then you get some fluid in that bursa and it like blows up and it gets really painful. And so we can actually see that. I do a lot of ultrasound diagnosis and procedures, and I can actually see that fluid. The other thing that might be a little bit more common, and maybe you've heard of a little bit more spoken about, I feel like it's more commonly known in media and in the literature, is tendinitis, and that is inflammation of the tendons. So I'm going to have a few more pictures of those, but that is the tendons that I talked about, your glute med and your glute minimus, those tendons that a tendon is what takes a muscle and then attaches it to the bone. Very important things. Unfortunately, we need them, but they cause a lot of pain. They are one of the banes of everybody's existence in primary care sports medicine, is trying to figure out how just to treat these things. But that is a big cause of the pain on that outside of your hip. So who gets it? And I've talked about it, women get it more than men. A lot of times we see it in middle-aged and older women. It can be in active and sedentary people. A lot of times we see it in increased BMI, and a lot of times we see it in with back and knee pain present, or that you've had that before. Why? So back to the anatomy. I'm very sorry, but I loved this picture because I think it illustrates things very well. So here we have again, got to find my mouse. There's my mouse. Okay, so this is your glute maximus. Your glute medius is right over here, and then that little guy with this minimus is over here. And I know I'm harping on those glutes, but they are so important in this. So the reason why we get it is anatomy and biomechanics, and then sometimes it's activity related. So maybe I see it a lot in people that have either been doing a lot of activity, they're increasing their mileage and running, or they've changed their activity, and all of a sudden sometimes they go from being very active to then getting a new job and being very sedentary, or the other way around. You're more sedentary and you start doing a new activity such as running, such as dancing, lots of different activities actually. And all of a sudden you're getting this pain. And then this is more actually recent in the last 5 to 10 years, is hormones, and more in the postmenopausal. So there has been some literature, not a ton yet, and I'm really, really hoping that in the next 5 to 10 years it's going to grow, but that the lack of, or the reduction in estrogen when we become postmenopausal might have some effect on tendon structure. Can't say for certain at the moment, more to come on that. And I really do hope that we have more in the literature in the next few years. So thank you, Lady Gaga, for coining this, but we are just born this way. So as you can see over here, this is the male pelvis, and then here's the female's pelvis. And everything that makes us attractive and sexy, well, sometimes it also causes problems. And then of course I had to use this little guy because who can't resist a corgi butt? But so you can kind of, this is a lovely diagram, and it has something called the Q angle, which really does talk about the angle between your hips and your knee. Very commonly talked about in younger athletes, such as women that have ACL tears. What is less talked about is that Q angle and how it affects the hips. So as I told you in some of the previous slides with the glutes, they have to, so this is the front. This is the front of your pelvis, first of all. Your glutes are all in the back, all over here. And so those come and make this really sharp turn, and they attach right here over in that greater trochanteric region. So they get pulled a lot. And the reason why is we have somewhat wider pelvises, as we've heard, childbearing, we have all this awesome potential, but it also can lead to a little bit more pain. So that's why it's a lot of anatomy, to be completely honest. So how is the diagnosis made? When I have patients that come to see me with hip pain, sometimes it can be like jumping into a black box. Where is this hip pain coming from? I usually do start with x-rays. And we get pictures of the pelvis. Here, over here is the hip joint. And I will be honest and tell you that, ladies, a lot of us do have arthritis. It's really not great. We all start to develop arthritis almost in middle age. You can start to see some degenerative changes, but I will tell you that most of the time that is actually not the problem. And a lot of times it's actually over on the outside. So how do I decipher that? Is usually using my physical exam. I have to use a physical exam to differentiate between a lot of different things. So this picture is not me, but I find myself in this position almost on a daily basis, trying to test the strength of this muscle. So this position right here, actually, on the right side of the screen, is testing that gluteus medius muscle, because that muscle doesn't do front and back movement. That muscle does side to side movement. So that is testing how strong that muscle is. And you won't believe that muscle can be really, really weak. And as if any of you see me in clinic, I'm always talking about how lazy tendons are painful tendons. So we're always trying to get those things to work. So that leads me to treatment, and it's all about that base. Got another reference, Megan Trainer, thank you, but I'm going to change it to butt. So what I do is I collaborate a lot with physical therapists, my physical therapy colleagues. I love them. They're so great. We work on tailoring a program specifically for that specific patient, because a lot of us have other things going on. We have knee problems, we have back pain, we have ankle pain. So I work a lot with the physical therapist to really tailor a program specific for that patient. And a lot of it does involve squatting, I will say. And then those bands that we handed out earlier today, ladies, those are to put around your ankles and to really work those glute muscles. So this is something that I find myself doing a lot. And it can be very helpful. It can be very painful in the beginning, because most physical therapy starts with a little bit of pain, but it is one of the best things for long-term pain relief. We also do some analysis of body mechanics. It really depends on what the etiology of the actual pain is. And so I in clinic will do some ultrasound diagnostics, because that really helps me identify the soft tissues and what is going on. But once we have diagnosed that, if we're thinking maybe this is a running problem, and you've just started running, or you're ramping up your mileage, or you're changing something, we can actually analyze that. We have a running lab where we do analyze some of that and see and make some tweaks in what could possibly be going on and causing that friction syndrome over that bone in your femur. And then lastly, as I said, I do use ultrasound for some diagnosis, but I also use it for procedures to target specific things. So if you do have bursitis, we can use some injections to help with that. And then summary, I really don't want hip pain to dictate your life. There are so many other things that are dictating our lives out there. We really do not need our hip pain to be doing that. It is certainly treatable. It's definitely not all arthritis, and it really is all about that butt. So I appreciate your time. Well, that's my contact info.